Hello and welcome to the Destin Business Forum brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our guests today are Kell, Elliott. You are the director of the Okaloosa Outpatient Center,
Yes.
And Craig Segrest. Did I get that right?
You got that right.
You are the community liaison for Emerald Coast Behavioral Hospital.
Yes, ma'am.
Okay, Kell, tell me, what is the Okaloosa Outpatient Center?
The Okaloosa Outpatient Center is an intensive outpatient program to deal with any mental health issue as well as substance abuse. We were actually formed as a step-down facility for the active duty military members in the area. At Emerald Coast Behavioral, which Craig will talk about, we started a military program about 4 years ago over in Panama City to deal with active duty service members struggling with stress, trauma,
Sure.
PTSD, substance abuse. And after a period of time, we were giving them good treatment inpatient, and we discharged them back to their command. And we weren't seeing the success that we thought we should see as compared to the treatment we were providing.
Okay.
So in collaboration with Hurlburt and Eglin, we created a step-down facility, Okaloosa Outpatient Center, to better give the service members an opportunity for success.
Is that, is it continuing after, whereas the inpatient program just kind of stopped? Is that the
That was the
difference?
original format. And since we've been here about 2 years, April was 2 years. And in that 2 years, we've also identified a need within the community for civilian members or Tricare dependents of active duty service members, and also the veterans. So we've kind of incorporated all of that into our 3 programs at Okaloosa Outpatient.
So basically, if someone needed help, anyone, they could call your facility
Absolutely.
and get some help.
Absolutely.
I would imagine that, I mean, everybody has stress, but our military, I mean, I can't imagine the stress that they must really suffer from during their time in the military and then afterwards. So this is nice that they can continue to get treatment.
Absolutely.
I asked you this question before we started the program. I said, do you have any success stories? And you said a good success story is if you don't,
We don't see them again.
If you don't see them again.
After we provide the treatment, they don't come back. That's a success story.
Yeah, it worked. But if they need to come back for tune-up's not the right, but just a little bit of treatment, that's still an option.
Absolutely.
Right?
Because there's new stressors that come along.
Sure.
And if they're not prepared for them, we're always available for them to come back to see us.
Kell, why did you get involved in this type of work?
I'm a veteran, and it's a wonderful way of giving back to the community that I was once a member of. And I'm just a believer in treatment for mental health and substance abuse. Sure. My background is actually, I'm a certified addictions counselor, so that's kind of how I got in the field, working with substance abuse. So it's a passion. It's a passion.
You really believe in it?
Absolutely.
All right. So going to work doesn't seem like work if you enjoy what you do, right?
It does not. It doesn't.
All right. All right. You told me who you served. Referral sources. How does somebody get to you?
They can actually just call our office. The number will be on the screen. That's 850-226-7893. And we will schedule them an assessment. We have 3 different programs. In the morning, we run a active duty/veteran program. And we also have a substance abuse program in the morning. In the afternoon, we have what we call just a civilian, which is basically just a general mental health program. Okay. So feel free to give us a call, and we'll just take your information and schedule you for an assessment.
So someone could, is that called a self-referral if they?
It is a self-referral, and we can also get referrals from, of course, our main referral source is the mental health clinics at the bases. But any psychiatrist or therapist in the area can give us a call if their patients meet the criteria for an intensive outpatient program.
Okay. And insurance, you take insurances?
All insurances except Medicare and Medicaid.
Okay.
Yes.
Gotcha. How about your staff? Tell me about that.
Our staff, we have LCSW. We have a licensed mental health counselor, LMHC. We also have a staff RN and a doctor of osteopathy. I think I said that right. Yeah. Dr. Diana Malazzo is our physician, so that is our staff at the Okaloosa Outpatient Center.
So you have a doctor there so you can prescribe medication if that's needed?
Within the program.
Okay.
Yes.
All right. Tell me where all you're located.
I
know you're located right here.
We're in Fort Walton Beach. We're in Fort Walton Beach out on Lewis Turner Boulevard, just past the courthouse. We also have another outpatient center up in Marianna, Florida.
Oh, wow.
We do, and we also have one in Panama City that is connected to the hospital.
Okay, so I'm going to shift focus to the Emerald Coast Behavioral Hospital. You're sort of a subdivision,
We are.
subset of that.
Under the umbrella. Of
Okay,
Emerald Coast.
under the
Yes,
umbrella.
ma'am.
That's a good word. Okay, tell me about Emerald Coast Behavioral Hospital.
Yes, ma'am. Well, I'm the community liaison for Emerald Coast Behavioral Hospital over in Panama City. That's our main facility there. And like Kell said, we do have an outpatient center attached to that main facility that focuses on the same things that Kell's outpatient center there does. We have more of a civilian population there at that outpatient center. But it does focus on the same things, behavioral issues, chemical dependency, things like that. As far as the main facility, it's inpatient.
Okay.
It's acute stabilization, so that means, they have, it's not residential long-term, 30, 40 days, it's more of the week to 2 weeks.
Okay.
So we get them through their crisis, get them stable, ready to go back out into their environment, back out into the world, reemerge, so to speak, and then we refer them to the outpatient center as kind of a step down. That way they're not going straight from a structured environment in the hospital to nothing at all. So now they go into the outpatient center, they receive that group counseling, that one-on-one psychiatric care, and just allows them to be able to handle that environment that they're going back into.
Okay, so let me make sure I got that right. You have inpatient for 2 weeks. Is that what you said?
About that, yes, ma'am.
About 2 weeks, dependent on
what their issue
their
is.
needs.
And exactly, yes, ma'am.
and then you refer them to someone outside.
Absolutely.
Would it be like Okaloosa?
It would be to the outpatient center there if that's what their needs. If that's suits them, what their issues are, or we'll refer them back to their provider that sent them to us.
Okay. So are they usually sent by a provider, or can they be self-referred as well?
They can be self-referred. We have a lot of people find us on the internet, Google. A lot of people from the phone books, and then from their doctor or provider sending them over as well. So there's a few different options.
And tell me about your staff real quick. We're almost out of time, but
Yes, ma'am. Yeah, we've got a few different doctors over there. We got 5 or 6 LCSWs and everything like that. We do have a Child and Adolescent Unit that focuses on ages 4 all the way to 17. We have a Child and Adolescent psychiatrist there, and then we have an Adult Services that's 18 all the way to geriatrics. There is no age cap.
Okay.
And then we also have a MRU unit, which is our Military Resiliency Unit,
Okay.
Which is for active duty veterans. The hospital will actually become their new station based if they're active duty, so they have to get up and do PT every morning, gives their commanding officer visitation rights and everything like that.
Perfect. Okay. I have learned a lot today. Thank you, gentlemen.
Thank you so much
Thank you
for
for
having us.
having
We
us.
appreciate it.
Come back and see us.
Yes, ma'am.
Thank you.
All right. We'll be back.